Hi everybody, it's Susan Hodges, physical therapist at Patterson Physical Therapy. I just wanted to touch base with you guys today about inflammation. We know that inflammation is probably the stem of about 90% of all diseases, and I just wanted to talk with you today and give you some information. I've got my handy sheet. I want to read to you what I wrote out, and I want you to let it sink in and think back to what you've eaten today or what you plan on eating tomorrow. Inflammation is the stem for 90% of most all diseases. After you eat foods with excessive carbohydrates, the blood glucose levels stay very high for a lot longer because the glucose cannot make it into your muscle cells because there's too much of it there. There's too much excess carbohydrates or excess glucose. This toxic level of glucose, it acts like tar in your bloodstream, and it clogs your arteries and it binds with proteins, and that's what makes the inflammation in your body. This high level of glucose causes your triglycerides to go up, and that increases your risk of heart disease. It's why you can see a 5'6" woman that weighs only 115 pounds. If you stop and talk to her at Kroger, she may tell you, gosh, my triglycerides are up and I've got really bad heart disease. You can have heart disease and not be, quote, overweight. And this is the reason why. So I want to clue you into a little fact that for every 4 grams of carbohydrates you eat, it is like eating 1 teaspoon of sugar. So when you eat that huge, big, white baked potato and you find out how many carbohydrates it has in there, remember that 4 grams of carbohydrates equals 1 teaspoon of sugar. So if you're eating something with 20 grams of carbs, that's like having 5 teaspoons of sugar. And I don't think many of you would just go to your white cane sugar and dip a teaspoon in it and just eat it. You would not eat that, but yet sometimes we don't think about the bread that we eat, the pasta that we eat. Those things have excessive carbohydrates in there. So I want to give you a list of foods to kind of avoid. The first one is, of course, excessive carbohydrates. You don't want to eat too much. It's okay to push away from your table and not be full. I want you guys to think about that. You have a refrigerator, there are fast food restaurants, there are grocery stores to shop in, but think about that 1/3 of the world today will not eat. They will be hungry, and there's no refrigerator to go to, and there's no pantry to go to. So this notion that here in America we have to eat all the time, we don't realize that it's okay to feel hungry. Number 2, vegetable oils. You want to stay away from all the vegetable oils. You want to use coconut oil or avocado oil, something that doesn't cause inflammation. Stay away from the vegetable oils. Number 3, of course, is sugar. You do not want to just eat teaspoons of sugar, so think about the little Debbie snack cakes or whatever your go-to is and try to decrease those in your diet. Number 4 are any refined grains. Now, refining means they strip away the grain down to its natural state, and then they put back nutrients into it. When you think about refined grains and you want to stay away from them, I'm talking about lots of breads, lots of pasta, lots of those wonderful pastries that we love to eat, even those fried foods that are rolled in breadcrumbs. All those are considered refined grains. An option would be to buy pork skins, grind them up, and roll your chicken in that to do fried chicken rather than the carbohydrates in the breadcrumbs. 2 more. Processed meats. A lot of the hot dogs, the salami, the bologna, different things like that has processed meat. So you want to stay away from that and do more organic or grass-fed meats, meats that are more pure. Meats are nutrient dense. They don't carry sugar, they don't carry high carbohydrates, so those would be a welcome addition to your meals. The last one is excessive alcohol. The liver just cannot keep processing the foods that you eat if you're adding a lot of excessive alcohol to your diet. So think on these things. Be proactive and ask yourself, the old adage is true, we are what we eat. And if you're having trouble medically with some type of disease, ask yourself what your diet is doing to enable that, and what can you do to take control of your body and your health in eliminating foods in your diet that are causing the inflammation. Thanks so much for watching, and you guys have a great day.